If you aren't thinking about the growing trend toward convergence within the U.S. healthcare system and how it will impact your organization, you should be.
Convergence is really the driving force behind what is going to be a fundamental transformation of the way the U.S. healthcare system operates.
Healthcare payers, providers, and life sciences companies should focus more on healthcare convergence and the broader implications of operating in a more collaborative and integrated U.S. healthcare delivery model. While transformation of current operations is likely going to be a business requirement, the real question is, what role will you play in a new and more converged health system?
So right now, some of the biggest risks to the payers are really around the change in the business model. They have always sold directly to companies, and they're really now in the mode of changing to selling to individuals. This is a huge shift for them. It's a real business model change.
Well, today's environment is evolving quickly, and probably the most significant thing that healthcare providers are doing are preparing to transition from a fee-for-service environment to an environment that will be based on the value of healthcare. And what that means is spending a lot more time with wellness and improving the outcomes of the population you're taking care of.
So in a system that rewards better outcomes at the same or lower cost, the interests of pharma could really converge with those of healthcare providers and payers in increasingly integrated delivery and financing models, provided that the products and services are of a sufficient standard. And given pharma's deep knowledge of testing and measuring the quality of outcomes and related costs, the industry can play a significant role in evolving broader healthcare enterprise. But to do this, it must demonstrate a clear understanding of the convergence of focus from stakeholders on value and cost.
The competitive advantage is going to come by combining data and that insight both internally to your systems and operations and externally, and beginning to create new insights. And those new insights are going to start to lead to new partnerships, new relationships in the industry, new products and services, and things that are going to enable much lower cost, higher efficiency, and higher quality. That's where we're going to start to see competitive advantage. So it's how we translate these capabilities into new technologies and new products and services.
The opportunity for those that recognize and act on this trend will be immense, but some big questions still remain. For example, how will we leverage big data across all the stakeholders to address the challenges around cost, quality, and access? What organizational capabilities will be required? How will incentives be structured in a more converged, value-based system? How will services and products be procured and reimbursed? How will convergence impact the patient and their standard of care, or what role regulation will ultimately play in catalyzing this shift? We firmly believe that convergence in the health and life sciences sector will ultimately create a more effective, accountable, and efficient system, and we're looking forward to working with payers, providers, and life science organizations to help forge ahead toward a system that delivers value for everyone.